to the second session of the day at the World Implant Expo 2021 organized by Dentistchannel Online. Myself, Dr. Shubhankar Nankirkar, as the host for this session. With us, we have the legend, the inspiration in itself, Dr. Himanshu Gupta sir, who has always been a guide, a support, and a mentor for me personally. And it's a great pleasure to and honor to have you, sir, with us. To brief down about Dr. Himanshu Gupta, sir. Dr. Himanshu Gupta is a practicing general dental surgeon and director administration for Sheikh Nandalal Dhoot Hospital. He is graduate in dentistry from Marathwada University, Aurangabad, and postgraduate in healthcare management from Symbiosis International University, Indian School of Business, and IIM Ahmedabad. He is also holding post-graduation in emergency medical services and medico-legal sciences. Currently, he is pursuing law from MP Law College, Aurangabad. He is the president for Marathwada Hospital Association, executive director, Maharashtra Village Transformation Foundation, secretary for Lions Services Medical Trust, secretary for Dentist Association of Aurangabad, past president of Indian Dental Association, and associated with professional organizations around the globe. He was trained by WHO in March 2020 for country preparedness for COVID pandemic. He is currently providing end-to-end clinical services to COVID patients affected by mucormycosis. His team of dental surgeons and dental specialists are working for surgical and post-surgical prosthetic rehabilitation of the patients affected by mucormycosis. He is also conducting research on mucormycosis, the multifactorial etiology, and its management. Speaking about COVID, Sheikh Nandalal Dhoot Hospital, under Dr. Gupta's leadership, has treated more than 15,000 patients on site and more than 2,500 patients virtually through teleconsultation. Dr. Gupta is extremely passionate about dentistry and is credited for launching oralcare.co.in, India's most advanced dental and oral healthcare facility in Aurangabad. It's an absolute honor to have you, sir, with us. Thank you so much for taking out time and guiding us on role of dental surgeon in treatment of mucormycosis. Dr. Himanshu Gupta, sir, all over.
Thank you so much. Thank you so much, Shubhankar. Thank you so much, Shubhankar. Dentistchannel Online for giving this wonderful opportunity to interact with the members of dental fraternity. And certainly the time of pandemic is just pushing off, and we are hopeful that very soon we will be back to routine dental practices, although the dental professionals have been badly affected during this pandemic. But I'm sure the ray of hope is much higher than what we have suffered from. And interesting is dental surgeons have played a major role in taking the supportive arrangements or the primary care or the diagnostics in this pandemic as well. They have been very proactively involved in doing a lot of work which were needed to assist the medical fraternity while treating the COVID patients. And it's my honor that I belong to the fraternity of dentistry that has taken a new shape, new role altogether in during this pandemic. And let me come on to the topic of how a dental surgeon can be of big use when we are treating not only basic but unknown etiological developments like mucormycosis. If I share my own experience in 25 years of practice, I just came across with 2 cases of mucormycosis before 2020. But in 2020, and other than the past 8-10 months, the number has gone enormous. We have been with a challenging part where the total number of mucormycosis cases have taken a newer dimension altogether. And I realized that we as the caretakers for oral cavity, we as the leaders to work for oral care, we have an important role. And being a dental surgeon, I always look into a possibility that what is available for a dental surgeon other than the dental specialist. Dental specialists are certainly doing a very focused work in their own areas of interest. But a general dentist has a lot of opportunity, a lot of commitment to safeguard the interest of a common man. And that's where I thought of sharing this topic of role of dental surgeons in mucormycosis during this ongoing, World Implant Expo 2021. And I'm happy to share that at Aurangabad, oralcare.co.in was the first organization to pick up first 10 cases of mucormycosis in Aurangabad Municipal Corporation limits. Not only that, I was given the opportunity to create a framework where I took the lead and created a group of ENT surgeons, maxillofacial surgeons, ophthalmic surgeons, intensivists for a better approach towards the cases of mucormycosis, mostly which were post-COVID mucormycosis. And I realized that if I can, take this as a diagnosis and treatment plan as a dental surgeon, then almost all my colleagues can follow the same pathway and treat such cases of mucormycosis. Not only mucormycosis, we should always be vigilant for anything which is new in the area of healthcare. And this has come up and blown the society like anything. Commonly, the layman is knowing it as a black fungus. This is not a new entity. It's a common commensal, which is creating a turbulent change in the level of infection and distorting the maxillofacial areas badly, along with involvement of eyes and other areas. So what is mucormycosis? As we know, it is defined as an insidious fungal infection, which is the fungal infection is spread by mucorales and zygomatic species. What is the relation between mucormycosis and COVID? We are probably well aware that this is due to then extensive pulmonary. There is a cycle how this link is getting established. I'm just taking a etiological development that how the COVID-19 patients got affected. What happens there is COVID-19 is an extensive pulmonary parenchymal disease and causes destructive pulmonary changes, and that results in weak pulmonary areas, which serves as a focus of attraction or infection during the pulmonary regions. In severe COVID-19 results, it is because of mechanical ventilation, which is giving for the patients during intensive care, approach for treating them. This can predispose to bacterial and fungal infections. So one, the weak area as lungs. Second, the treatment per se is giving them this opportunistic infection to seep in. Then alteration of the innate immunity. Because of the COVID, the immune system of the body is dysregulated, and that dysregulation is often picked up by evaluating the T cells, which also includes CD4 and CD8 cells. This is basically happening due to immunosuppressive medication. We know that in COVID, the treatment at large is using a lot of higher antibiotics, even the steroids, the varied degree, varied level of different medications, antivirals. So overall, there is an immunosuppression which is clicked in, and because of that, the COVID-19 patients are more pro for mucormycosis. Even certain immunomodulators which are used along with antibiotics to treat COVID-19 infection makes the patient pro to this fungal infection of mucormycosis. Not only mucormycosis, even other fungal infections can seep in, but at large, what is majorly disturbing the population is mucormycosis. What happens, how it takes place is another interesting area. During the stay, onset, and the treatment of COVID, there is a stage of hyperglycemia which is there, and that causes the right, that gives the right nutrition for these mucorales to penetrate and destruct the endothelium. And because of this change in the whole state of internal corrections which are happening within the body, there is hyperferritinemic syndrome. That means excess intracellular iron that generates reactive oxygen species, causing tissue damage, which is visible as the outcome of mucormycosis. So this is in a nutshell how the mucormycosis is happening and why it is happening and why it is more pro in COVID positive patients. Now, if we look into the etiopathogenesis of mucormycosis, we will realize that the causative organism mucorales, when they are already available in the natural soil, plants, manure, and decaying fruits and vegetables. They are the common cells. So they are very closely available in the nose and mucus of even healthy people. But in healthy people, they are not affecting because the atmosphere, the immune system is already good. And when the immune system is weak enough, which was the case in the COVID-19, the healthy people affected by COVID are subjected to the possibilities of mucormycosis. What is the commonest route of infection? Either by ingestion or by inhalation or by traumatic inoculation. In the cases of COVID, it was more related to inhalation. What are the predisposing factors for the disease of mucormycosis? It is basically due to uncontrolled, it's a combination. It's uncontrolled diabetes mellitus. Even in cases of malignancies where the patient got affected by COVID, this was quite visible. If the immune system is already weakened, like in AIDS or renal disorders, or even the trauma, complicated trauma, or second or third degree burns, this has been as the part of disease getting affected. Even in the cases of malnutrition, there are higher chances of predisposing of this disease. Certain medications like steroids, immunomodulator, tocilizumab, itolizumab, higher antibiotics, high doses of zinc, vitamin C. These are the medications which have been taken as nutrition by mucorales, and that's where the disease gets initiation, and then it becomes full-blown as all these medications are becoming the precursor for initiating the infection. What happens with that? There is a stage of immunosuppression. There is ketoacidosis. There is high serum ferritin, which is seen in these patients. And of course, in all such cases, there is a prolonged hospitalization. There was a thought that is this happening because of oxygen being given to the patients for long, though it was considered as one of the factors, but no proof has been there in any of these studies mentioning that this is the case. Yes, there was a trend where the moist oxygen was taken as a better medium of oxygen delivery for patients rather than the dry oxygen. So that is one differentiating point which we came to know across many hospitals when we were evaluating the cases of mucormycosis getting admitted to the hospitals. Different types of mucormycosis. Rhinocerebral, where the incidence rate is close to 47%, pulmonary, cutaneous, gastrointestinal, disseminated, and other sites. However, in current scenario, the combination was more of rhino-orbital cerebral or rhinomaxillary. And that's where we were focused to see from the part of dental origin that how this destruction is happening and how the disease is progressing. Clinical presentation is often with the pain, redness around eyes, nose, fever, headache, coughing, shortness of breath, bloody vomits, or altered mental status. These were the commonest observations while evaluating the patients clinically. And these are also related, if we see widely, these were also the common symptoms of COVID as well. So when we see such patients, the evaluation has to be in time. And when we evaluate them in time, we can diagnose them in time. When the patients are getting affected with mucormycosis, this is what is visible. Swelling, panfacial swelling, paresthesia is the observation. Sinus tract on face, discoloration of skin, infection in dangerous areas of face. We know that the nose and the surrounding areas, they combine and prepare a danger zone. So that's become the area of concern, and the patients are at high risk. And when we want to evaluate intraorally, the picture is very disastrous, and the findings are halitosis, intraoral pus discharge, ulcerations and blackening of mucosa, exposed palatal bone or any area of bone which has been affected, multiple sinus tracts, loosening of teeth, many unhealed tooth socket-like appearance, mobility of maxilla, crackling sound, and even in certain areas, if there is good destruction along with a lot of periodontal changes or oral cavity changes. What investigations we can always look for? Radiographic examination. In our consideration, we were very lucky to have in-house CBCT, and by performing CT-PNS, we were able to pick up such cases very early, and that's where I said that we were lucky to identify close to 10 patients very early in our center, and we reported it to Aurangabad Municipal Corporation, and that's how the whole channelization of a standard protocol came in picture at Aurangabad for the patients of mucormycosis. When we involve the ENT evaluation by ENT surgeons, direct microscopy, QOH, wet mounts, these were the examinations which were performed. Clinically, whatever you are finding as a initial diagnosis, you have to strengthen it with facts and findings. So even the lab parameters were of interest: complete blood count, dearranged ESR, fasting blood sugar, postprandial blood sugar, along with HbA1c. Was found that it's quite disturbed. HbA1c is on higher side, blood sugar levels are dearranged, and these are the factors which we have to monitor, and with the help of clinician, intensive care person, we have to treat in time. From dental professional point of perspective, at my center, we took the biopsy from deeper portion of extracted tooth socket or the exposed bone, and send it across for pathological investigation. There, and that's how we started diagnosing case at a very early stage. And sometimes the ENT people, the ENT surgeons are looking for nasal endoscopic examination. In few cases, even the cerebrospinal fluid was also indicated for investigation. Certainly, the changes what were happening in the COVID-19 affected population for mucormycosis were very rapid. The picture was deteriorating from day 1 to day 2 and from morning till night. So the deterioration in such cases was very, very rapid, very, very aggressive. And what was the treatment? Protocol-based treatment. Surgery, if we have to opt for the correction early, then we have to approach early. And aggressive surgical debridement of dead tissues was advised. And when we referred these cases for further treatment to the maxillofacial surgeons and ophthalmic surgeons and the ENT surgeons, the commonest way of approaching towards these cases was surgical intervention along with medical management. So that combination has worked right. And we were able to limit the destruction. We were not able to 100% control the destruction. Almost in all the cases, there was a combination of surgery and medical intervention. So during the medical intervention, we were aggressively treating by debriding the dead tissues. Surgeries which were in terms of maxillectomy, in terms of partial or complete debridement of the affected maxilla, zygoma, orbital floor, walls, whatever area has been affected was surgically cleaned using the debridement techniques. When we are involving for the areas where the rhino-orbital part is involved, then even endoscopic sinus surgery or exenteration of eye was also the part of the surgery. So the destruction in mucormycosis was on very, very higher side. Then also, when we are doing the medical management, we have to correct various predisposing factors as well. Important was to have a right control of blood sugar levels with electrolyte management. Fluid management was very important. And earlier, the better was the approach in managing the predisposing factors. When we talk about the medical management, we know that injection amphotericin was the drug of choice along with tablet posaconazole. So antifungal combination has worked well in such cases. However, the drugs were not easily available during that time, and that was also one of the sufferings for such patients. Evidence was there to avoid nephrotoxicity and hypokalemia in such patients, which were the side effects or the interactive outcomes of the medical management. Here comes the important part, that how in such cases we can look into the post-surgical rehabilitation of the mucormycosis cases. And here is the role of dental surgeons and the dental professionals, which is of higher interest. First is to understand what is the need for the rehabilitation. We know that when we are removing a major part of the face or intraoral cavity, then certainly we need to take care of the well-being, and that well-being is possible only when we restore the lost tissues, whether hard or soft, in such a way that the patient is able to survive functionally with a normal profile. So there was certainly a definitive need for post-surgical prosthetic rehabilitation. Post-surgical defects, they will help the patient for restoring the functions and quality of life. And the objective of my maxillofacial rehabilitation, including the prosthetic reconstruction, was to cure the defect, improvise on the function, certainly to enhance the aesthetic or cosmetic look, and allow the patient to get back to normal engagement in society, and to boost the spirit of the patient. Such patients were badly affected for long duration of illness. So the morale was low, and it is our responsibility to get them back to normal. What we have considered while doing such rehabilitations, the cost has to be within limits, as we know that the rehabilitation, maxillofacial rehabilitation, is a expensive affair. Then the biocompatible approach, because we need to see that whatever we are putting as prosthesis or reconstruction has to be biocompatible. Aesthetics is the major concern, where we need to see how it is fusing well with the intra and oral tissues. Then the use, how well sometimes even a small obturator can help to restore the function and to restore the quality of pronunciation. So we need to see whether the prosthesis is comfortable to use or not. Then maintenance, how easy it is to maintain. And of course, we have to provide maximum possible functional and aesthetic rehabilitation. So this is one step which was possible to be performed by our group of dental surgeons. Very simple approach. This has been recommended multiple times, and this is a time-tested technique of two-piece hollow obturator, where the gap was just sealed with the help of obturator, and you can see that how properly the defect has been restored, and there is a prosthesis which will allow for good function. When we are doing maxillectomies, then certainly the dentulous span of the defect is on higher side. So in such cases, even the implant-based prostheses were possible. Yes, you have to evaluate the bone in a proper manner. You have to understand that the bone in such areas has to be rigid, because osseointegration is one quality of one quality requirement when we are doing implant-based work. So when we are performing these implant-based rehabilitations, we have to be very, very sure about the quality of bone to rehabilitate such cases. But these are the possibilities. And what now has been the further extensive replacement, this is seen from the cases which are available in the domain of dentistry, that how the rehabilitation is possible even if the maxillectomy is bilateral. These are the work which are done by various authors all across, and this is an example of an implant-supported prosthetic rehabilitation where the complete maxilla was restored using the framework of cortical implants. So these are the possibilities. These possibilities can be explored only when you are equipped with basic diagnosis. You are equipped with diagnosing a case in time and giving the treatment in times. When the patients are looking for the rehabilitation, these are the options which are very much available for every dental surgeon. Prosthetic rehabilitation, we can see here that these are all the options which we are aware of from our prosthetic dentistry literature, but we might have not opted frequently. But mucormycosis cases where the orbital destruction is complete removal of eye, then the replacement is by prosthetic placement of aesthetic way to restore the lost eye. So these are all the possibilities which are there with us, and if we look with an intent to not only treat the basic issues of the disease, but also to rehabilitate the patient back, these are the considerations which we should always keep in our mind. So if we see what is the role of dental surgeons in management of mucormycosis, we know that we are the first line of doctors to whom patient approaches. and we can investigate, we can inspect, we can look into such cases, and we can prevent further damages, we can restrict the damages. So role of dental surgeon is very important in early diagnosis of mucormycosis. And then it is our responsibility to channelize such patients to the right team. It's a teamwork. Only dental surgeon alone may not find it easy to handle such cases. But when you involve a maxillofacial surgeon or ENT surgeon or an ophthalmic surgeon at right time to minimize the damage, your responsibility is much higher than anybody else. And you can certainly play a major role in post-surgical rehabilitation as well, because obturators, implant-based restorations, prostheses, all are possible to be performed at our end. So early diagnosis, then proper planning, appropriate referral is the key to management of mucormycosis, where dental surgeons are playing major role. And we are not only playing major role in diagnosis and treating the disease, we are also playing major role in counseling the patient. Such patients have lost their complete, confidence, and they are already suffering with the disease for a long time. So it is our responsibility to make them realize that, fine, whatever has happened, but here onwards, we can take your good care, we can provide you a quality life, and we can rehabilitate you back, so that whatever damages have happened will get a good rehabilitation. And that is where the dental surgeons have to take such approaches of counseling so that the patients are motivated and they are accepting the given treatment in time. It's a teamwork, complete team approach. And when we do it as a team, we realize that we can do much better than what is expected only from an individual. So right time, right approach is the key for right management of mucormycosis. And the team is of dental surgeons, radiologists, maxillofacial radiologists, maxillofacial and plastic surgeons, ENT specialists, ophthalmologists, intensivist, neurologist, microbiologist, biochemist who is taking care of the medicines as well. And when we go with the team approach, this is how we receive good, successful outcomes. Thank you so much for giving this opportunity. I just wanted to bring to everybody's knowledge that we as dental surgeons are well equipped with basic understanding of issues. We are well equipped with the tools and techniques of handling. So we should take forward the early diagnosis and early planning of not be able to intervene and execute a lot of procedures. But when we evaluate and when we design the treatment plan at the right time, probably we are doing much bigger work for the safety and outcomes of the patient. And that is a big possibility for every dental surgeon, which is working in the clinical dentistry space. And I'm sure that still the post mucormycosis patients are visiting the dental clinics, and we should look forward with a positive approach. The procedures we can perform within our expertise, we should do it confidently. The procedures where we feel we need to take support of a specialist, we should be able to refer our patients or involve the specialist in right time. Our aim has to be early intervention, early treatment. Thank you so much for it. If you have any questions, I'm there.
Yes, definitely. It was a very concise and explanatory concept about role of dental surgeons, sir. And definitely, I'm sure that all the attendees must have gained a sense of confidence and also changed their vision of looking towards mucormycosis and contributing more towards the same. Thank you so much, Dr. Himanshu Gupta, sir.
Thank
Uh,
you. I think I
yes,
have received one question from Sudeep. When can we expect
yes,
these symptoms post-COVID recovery? So I would just share with you that these symptoms are right from the last phase of treatment of COVID. So it may not be only post-COVID recovery, be intra-COVID recovery as well. And it is very, very important for the medical professionals to involve dental professionals for basic evaluation of oral cavity. Being with a COVID hospital, we made a very clear directive that every COVID patients will undergo dental evaluation. So when we were evaluating oral cavity, we were able to sense if there is anything going wrong. So at our center, we have seen that the patients with the beginning of mucormycosis or early symptoms were intra-recovery as well. Post-recovery was very common. Second question is from Hiral Patel. 2 doses of vaccinations done. So chance of COVID? Yes. Vaccination per se is reducing your chances of complications. The cytokinin storm, which is fatal to anybody's life, is one important protection which has been due to dose of vaccination. Being dental surgeons, we are at the risk. So we have to be very, very clear in understanding the importance of vaccination, that it is not saying you will not have. Vaccination is just preventing the type of complications and the type of recovery which is happening. So it is just giving you early recovery, less chances of complicated issues of the COVID-19 disease.
yes, sir. I guess these were okay. We have one more question. We have one more question, sir. Is tiny lumps on side of
the question is tiny lumps on sides of the tongue around 1 millimeter. Is that a post-COVID symptom? The post-COVID symptom will generally be seen more on the bony levels, like in the alveolar area, maxillary bone area, or in the areas which are with the presence of hard tissue. It's very difficult to find a very small lump being the feature of COVID, post-COVID symptom. So only one tiny lump or a group of tiny lump could be something else until we see and evaluate. It is difficult to say that it is directly or indirectly related as a COVID symptom.
Yes, sir. One more question is that I have seen cases who had a history of steroid treatments and are immunocompromised. Is there a chance that otherwise healthy patient can also be affected after COVID?
Yes, if there is a history of steroid treatment and the patient is immunocompromised, basically this is becoming the fertile land for mucormycosis. So though the chances of any possibility of mucormycosis in a healthy patient is less, but when the patient is with steroid and immunocompromised, probably this patient will not fall in category of a healthy patient.
Yes, I guess that's all. And I have a small presentation to be put forward just before we end the session, sir. So
Yes.
the World Implant Expo 2021, which is organized by Dentistchannel Online. Next. We have various experts and the legends in the field of dentistry on a single platform who will be guiding us throughout different topics of implantology, right from the basics towards the advances. Next, we have about the organizers. The Dentistchannel Online is a private limited is a leading dental media company that aims to share the awareness and knowledge regarding various aspects of dentistry. We conduct regular webinars and courses on different areas of dentistry. Being a prime member of Dentistchannel Online brings you several opportunities, accredited webinars, and dental courses. Next, we have being the benefits of being prime member. Every prime member will be entitled with a certificate of participation with 30 CPD points accredited to the State Dental Association of Rhineland-Palatinate, Germany. Next, we have the sessions lined up for today as well as tomorrow and the upcoming days. But unfortunately, due to some unavoidable circumstances, the session which was to be taken by Dr. Himadri Chakravarti is rescheduled to 12th of November from 12 p.m. to 1 p.m. You can visit www.worldimplantexpo.com for the further details. You can just save down the number which is present on the screen. If this number is being operated by Dentistchannel Online, and you just need to send in your full name and you will get each and every update regarding the events and activities. Then we have for you guys the proud sponsors whom we are grateful to, who have been a great support in conducting the expo: Mono Implant, Unicorn Dentamart, and various others. And you can also follow us for all the recorded videos on Facebook, Instagram, and YouTube. Our handle name is Dentistchannel Online. Just go out there and gain the knowledge whatever you wish to. Yes. So once again, I thank you, Dr. Himanshu Gupta, sir, and each and everyone who has joined us for the session. As I mentioned earlier, the session which was to be taken at 3:30, unfortunately we had to reschedule it on 12th of November from 12 p.m. to 1 p.m. and we expect a great response for the same. Now we will meet for the next session at 5:30. See you all. Thank you so much. Thank you, everyone.